So myself, Lokeshwar, Assistant Professor from the Department of Speech Pathology and Audiology, SDUAHER Kolar, and also a member of UCHPE here. So I welcome you all for this webinar on educational scholarship. So the speaker for today will be Dr. Subhashis Das. So he's a distinguished professor and head of the Department of Immunohematology and Blood Transfusion at Sri Devaraja's Medical College, Kolar. So he holds specialized training in cytology techniques from St. John's Medical College, Bangalore. He has over 50 publications and authorship of several books. Dr. Das has earned a PhD in pathology, showcasing his commitment to scholarly contributions. His accolades include the Best Faculty Award in 2018 and recognition for outstanding contributions to the field of pathology. Dr. Das has been honored with the Excellence in Research Award in 2019 and received the Asian Association Transfusion Medicine Fellowship in 2017. Additionally, he holds a prestigious INSA Fellowship from Indian National Science Academy, New Delhi. In the realm of medical education, Dr. Das completed the FAMA Fellowship in 2019, and his dedication to outstanding research in pathology was acknowledged with the Venus International Year 2020 Award. Dr. Subhashis Das stands as a beacon of excellence in both academia and medical research with a notable impact on the field of pathology. We welcome you for this webinar, sir.
Good morning, one and all. Thanks, Dr. Lokesh, for your excellent introduction. So I have been asked by the Department of UCHPE to speak about educational scholarship. I thank the department for giving me this opportunity to speak, and I'll be sharing my few thoughts on this topic with the esteemed guests. So coming to educational scholarship, the learning objectives are define educational scholarship, define scholarship cycle, and compare the contrast scholarly teaching with the scholarship of teaching and learning, and define classic 6 elements of scholarship. So these are the few basic things which I would like to highlight during my course of talk. Now, what is scholarship? Scholarship is a tangible product such as a journal, article, a book, a presentation, or an endurable educational product of new knowledge or its presentation that was peer-reviewed and publicly disseminated, from which others can learn from and build upon. So this is the actual definition, and the definition should have 4 basic elements. That is, it should be a tangible product, a new knowledge or its presentation should be defined, it should be peer-reviewed, and most importantly, publicly disseminated, from which others can learn from and build upon. So these are the 4 parameters which will define what is scholarship. Now, scholarship is a vital area.
Parcel service, so we have ordered the no problem. I'm so sorry I asked. No problem, ma'am. Absolutely no worries.
Scholarship is a vital area of both practice and inquiry, whether that leadership occurs in the education domain or in the field of research or both. The term scholarship occupies a broad place semantically, conceptually, and in practice. In fact, scholarship signifies the principal space that connects integrity, research, teaching, learning, personal development, and contributions to the world. So what we want to say from this definition is it is a multidisciplinary approach, and which involves a contribution and integration between integrity, research, teaching, learning, personal development, and contribution. So it is multifactorial and it is multidimensional. So scholarship is basically based on an excellent work done by Boyers and all, and Boyer's expanded definition of scholarship involves the scholarship of discovery, the scholarship of integration, the scholarship of application, and the scholarship of teaching. So these are the 4 vital parameters based on which Boyers defined scholarship. So discovery means original research that advances knowledge within a discipline. Integration means it involves synthesis of information across various disciplines, across various topics within the discipline, or across the time. Application means application of disciplinary expertise to be shared and evaluated by peers, whereas teaching means transmission, which involves systemic study of processes involving teaching and learning, which effectively transmits disciplinary expertise. So here we see the cycle of integration and learning, which says it is dynamic and non-hierarchical. It involves integration, application, transmission, and discovery. And at the same time, both are multifactorial and it can be in vice versa also. Now, many of us are scholarly teachers. What and how we teach is informed by the scholarship of others. That means area, for example, area is of clinical care and treatment. It is an activity when we are providing treatment to patients. However, it is called scholarship when teaching, publishing, or presenting procedures to or from other teachers. So this is an area such as teaching and assessing students. However, it becomes a scholarship when teaching other technicians to teach and assess others as well. For example, outreach. Outreach can be considered just as an activity when telling the community about the services, but the same outreach becomes a scholarship when we are informing others how to design, implement, evaluate those services. For example, research. Research, where when we perform an RCT or other experiments, but the same research becomes a scholarship when we inform other researchers about their results and consider their valuable feedback. Scholarship is to be created by compulsion, not by compulsion, but by awakening of pure interest in knowledge. Now, this is something about Glassix, which has laid main foundation regarding scholarships, which include clear goals, preparation, appropriate models, adequate results, effective presentation, and reflective critique. So these are these Glassix 6 measures of scholarship. Based on this, educational scholarship is carried on. Now, clear goals. Clear goal means, is the basic purpose stated clearly? Are the important questions in the field identified? Are the objectives realistic and achievable? And what are you adding and what should I care for? So these are the parameters of clear goals. Now, coming to adequate preparation, have you done a critical review of the literature and are you using an appropriate conceptual framework? Do you understand what has been done in the field and are you taking it to the next level? Or are you bringing the appropriate skills and resources to the table? So this is the important parameters of clear goals and adequate preparation. So clear goals should include all these three basic parameters that I have just enumerated. Adequate preparation also should include all these three above parameters that I have just enumerated. Methods involves the following things. Are you using the appropriate methods to achieve your goals, quantitative or qualitative, or have you applied them appropriately to the question that we want to design? Or it should be based on optimal design with sufficient sample and data. Results is something that should involve, did you achieve our goals? Did your work contribute to the field, or what were the new frontiers that we worked upon? So these are the three important parameters upon which the result should be based. The fifth one is the effective presentation. The fifth effective presentation involves, is your style and organization effective? Are you choosing the right forum for the right audience? Or any take-home messages are clearly demonstrated or not? So these are the measures for effective presentations. Now, coming to reflective critique, here we collect the feedback and critically analyze it. Did you critically evaluate your own work? Is your critique based on a solid breadth of evidence? Are you using evaluation to improve future work? Do you acknowledge limits linked with the bigger picture? Have you made any insights or reflect on any unexpected results or identify future opportunities for research? So these are the things where we collect the feedback and critically evaluate ourselves and decide what is the further room for improvement. Now, Lee Schulman is another pioneer for educational research. He has defined scholarship as the workshop must be made public, the work must be available for peer review and critique according to the accepted standards, and the work must be able to be reproduced and built upon by others. So these are the three essential parameters which, according to Lee Schulman, should be the most important defining criteria for educational scholarships. Now, there are three P's that we should always remember while discussing educational scholarships, which includes professional interest. That means inherent obligations and responsibilities to the discipline associated with becoming a professional scholar or an educator. Pragmatic responsibilities which will ensure that one's work is constantly improving and meeting the learner's objectives and needs. And also the policy pressures, that is capacity to respond to external social and political demands and expectations. Now, what are the criteria for scholarship? That is very, very important, which includes it should have clear goals. It should involve adequate preparation to include understanding prior to scholarship, methods that match the goals and follow from prior scholarship. It also involves results that should be meaningful and honest. There also should be dissemination of results with clear, organized presentation. And also the most important one, the last one, the reflective critique in the context of prior scholarship and study limitations. So all these parameters should be fulfilled to have a good educational scholarship. Now, educational scholarship as career prospects involves scholarship in medical education, aims to develop and highlights the importance of teaching and learning through systematic study, dissemination of acquired information to public, and inviting critical appraisal from fellow colleagues. Faculties receive knowledge through professional development and contribute in academic field using the acquired knowledge in the form of scholarship. So scholarship is a two-way mechanism. On one hand, we receive the feedback from the information gathered from our colleagues, and at the same time use this information to further develop and disseminate the information to others. Now, how to make educational scholarship as a part of your career, which everyone should be worried about. So there are few questions that we should know. Always ask questions and seek answers to the best ones. Seek mentors or experts to help guide your scholarly work. Build upon productive collaborations, that is, look up across various disciplines at your institution for people in similar role, or look at other institutions for people in the same role. Take advantage of ready-made networks in professional organizations. So this is the way we build upon this scholarly network. Find out what others have done. Develop scholarship around your other responsibilities. So multitasking should be encouraged. Plan new teaching activities around the current educational program structures to avoid political and scheduling challenges. Seek stakeholders' support for our work effort and be the solution, not the problem. Find opportunities in challenges faced by our institution and try to overcome them. Pass it forward, share your knowledge and expertise amongst your peer educators locally and nationally, and build your work and actively document it upon three hallmarks of scholarship, that is, public dissemination of information, peer review, and providing a platform for others to build upon. So these are the three basic things that ultimately should be looked upon when we think about making an educational scholarship as a part of our career. Now, what are the essentials of scholarly approach? First is teaching. Any activity that fosters learning, including direct teaching and creation of associated learning material, creation of learner material strictly for enhancing one's own teaching. So teaching is essentially based on these two parameters. However, it becomes a scholarly approach when we describe how one teaching is informed by the literature and document participation in personal learning. So the same activity can be, escalated as a scholarly approach if we follow this, describe how one's teaching is informed by the literature and documentation participation in personal learning activities. Next is learner assessment. All activities associated with measuring learners' knowledge, skills, and attitude, analysis comparing others' data with the correct answer, and synthesis and interpretation. However, it becomes a scholarly approach if the presentation on the assessment process or outcomes to the local audience, peer-reviewed or invited presentations and workshops at professional meetings, or acceptance of the assessment tool in a peer-reviewed repository. So these are the assessment, but when it is done in a scholarly approach and when it is peer-reviewed and presented to a scholarly gathering, it becomes a scholarly educational scholarship. Curriculum development is defined as a longitudinal set of design educational activities that involves evaluation, more than one teaching session or presentation, and can occur at any level of training. However, it is considered as a scholarly approach when we demonstrate that curriculum design was informed by literature and best practices, a curriculum designed to target a notionally accepted competencies. So when we design our curriculum based on the best practices and cater to the accepted competencies, it becomes a scholarly approach. Mentoring and advising is also very much a part of educational scholarship. Educators often serve as mentors and advisors for their trainers and colleagues. Mentoring implies a sustained, committed relationship from which both the parties obtain reciprocal benefit, whereas advising is usually more time-limited and one-directional. Documentation should describe the nature of relationship and one's effectiveness in helping mentees and advisees to meet their goals. Education, leadership, and administration also involves creatively designing and evaluate improvements, show that we are making revision based on feedback, best practices, external peer review, and document ongoing quality initiatives. Now, educational scholarship today, the status reflects new faculty tracks that needs to be developed, evolving promotion and tenure criteria that needs to be explicitly defined and with examples of acceptable activities. Then we should also develop support mechanism, very, very important for educational faculty development training. We should also have educational innovation grants. It should also involve increased dissemination options such as journals and educational materials. We should also include new reward and recognition options for such as teaching educational awards, outstanding educator receptions, and so on and so forth. Now, 10 top challenges that we develop for educational scholarship. Finding a program director with a fire in the belly, who should be able to be very much committed to the dissemination of program and do work accordingly. Recognitions and rewards for participants. We should have for successful program graduate stipends, merit, certificates, medallions, and publicity. We should be involved in this. Then we should have a program budget, space, and support staff to carry out the activities. Develop measurable outcomes so that program outcomes are successfully evaluated and feedback is obtained. Then we should identify relevant activities to the programs, workshops, and journal clubs. We should have frequency of contacts, monthly, quarterly, and the duration of contacts. In addition, we should have institution leadership and support, willingness to demonstrate from the top administration and institutionalize the same if successful. Have a clear-cut purpose and goals so that, proper emphasis on skill development and recognition. We should have specific eligibility criteria to include or exclude someone and expectation and consequences. So we should be clearly defined what are the minimal expectations for a participation and complete it accordingly. And also there should be a consequences for non-completion. This is the book from where we have taken few feedbacks while drawing up these slides. This is the curve of scholarly activity, where it shows from anxiety to when happiness, fear, threat, depression, hostility, gradual acceptance, and then moving forward. So this is the cycle of scholarly. We start with anxiety and then slowly we move ahead with the various phases of life, various phases of activities, and then ultimately we can complete it and finish it and prove it that we have done it. Thank you.
Thanks, Subhashis. So I would like to thank Dr. Subhashis Das, FAMA Fellow, and also a professor of Immunohematology Department of us. And I would like to bring in this whole slide again for all of you to reflect on where we are currently. We chose this topic this time because there were a lot of challenges. People were good in research in general when we're all accredited universities. When they talk about research, biomedical research was something that was really focused on. All our funds and all the awards and achievements was and collaborations was towards biomedical research. And then what we saw is if we try to club NMC, National Medical Council, and the National Accreditation Council, the NAC and NMC, what we see is what we lack is the educational research component. We have been doing so much with respect to teaching, learning, and innovation in alignment with competency-based education, both in UG and PG curriculum. What we observed was this was not being documented. So Dr. Subhashis has very explicitly demonstrated what is the importance of, what is the difference between just teaching or assessment or learning as compared to when do I call it a scholarly activity. So the process of putting it down and helping dissemination of what each one does across the globe, because all over now we talk about outcome-based education. We thought youngsters have to be motivated in having this plan. So whatever we do, if you put it down on paper, if we circulate it, it can be, we have very lot of mediums like MedPortal and lot of avenues to platforms to share this. It'll help each other. So this personal learning, when you document the efforts I put towards my own learning, will contribute learning of other faculty. So educational research should be taken up in a big way. And I think NMC, as it recommends promotion, I think one article, it should say, among the 2 articles it considers for promotion at every cadre should belong to educational research. Because at the end of the day, patient care and student learning is equally important for a teacher. So I would like you all to comment on or what you gathered from this or your own experiences or any questions to Subhashis we would like to take. Yeah, anyone who is planning to we also know how each institution is encouraging faculty to enroll in these fellowships, FAMER being as the forerunner, how we encourage faculty to get an idea about capacity building in terms of educational research or scholarship. So any questions to Das or any sharing of experience? We are more than happy to take.
Ma'am, I have a question.
Yeah, please go.
Yeah.
Could you please introduce and then you can, yeah.
I am Dr. Ajit Dabholkar. I am a professor in D.Y. Patil School of Physiotherapy.
Okay.
My question is regarding how to, develop research interest through, development of research interest group in the university, something like that, because, there are people who are not much interested in educational research. But if we develop some research in educational research interest group, can we have such type of a collaboration in universities?
Yes. To start off, we should have this intra-university. We have various disciplines, right? I don't know if yours is the only discipline. Normally, in all our academies, we have various disciplines like nursing, dental, physiotherapy, speech and hearing, and allied health sciences, medical. So this provides an opportunity for us to brainstorm and also think of things that are common. When I say educational technology, it's all common, isn't it? So the moment you break barriers and silos and talk to each other, talk to each educator in your own academy, then we create a critical mass. So when we start for example, if there's a teaching learning methodology that is really working well in physiotherapy, we have really good things happening in our physiotherapy institute. It is easier when we provide a platform for them to conduct a workshop. And for example, interactive tools, our physiotherapy staff conducted with us and shared so that faculty of medicine could take it up. So I think creating these platforms where each one shares their innovation, I think that will kindle the desire in youngsters. And when you see the feedback from students who are enjoying this and them being stakeholders and given importance, and then you have to show this outcome, right? That is where actually fellowship, the research scholarship works. You show this to your administrators. How do they know even it was really helpful? When it comes out as a paper or when you go and present in conferences, how many of us actually motivate our younger faculty to go and present in? How many of us tell that there is a NCHP conference, there is a MU conference, why don't you present there? Why don't you go and attend a workshop? So these are all visible things. I think each one of us will have to take lead, I think. And then we can think about inter-university collaboration. We have to motivate staff who are still new to this domain of health profession education and talk about going and presenting papers. And I think then it helps. That's my personal take. If others have anything else to offer, they can share with us. Yeah, we have on the chat box. I guess more should be done to raise awareness on the importance of assessing the quality of all educational activities and the models available to evaluate the training outcomes. Yeah, this is almost similar to program evaluation. Anything new that you start, even if it is as simple as flipped classroom, if you create a program evaluation and you put it up as a paper, you share your experience as a short communication or whatever it is. Definitely all over, like people talk about it. And then when you go and present papers, we discuss about it, how feasible. We learn from others as to how you can tweak it to suit regional contexts. We have to send our faculty to attend conferences, first as participants and then as presenters. And maybe they will be called as resource persons once they get involved in this. We have to make a beginning in our own classrooms.
Thank you, ma'am.
I'm happy that all the disciplines have taken it up equally now. Initially, we used to have more of medical education. Now you see health professions education like taking up in every discipline. So we can think together. Anybody else would like to share what is their take on, like where do they see their institution stands with respect to educational scholarship? If you're doing anything different or if you are doing anything novel, you can share with us. How many of you have mandatory presentations? Like how many of you have your academies imposing mandatory presentations and involvement in educational research publications? Yeah. Okay. If that is the... Yes. Yeah, please go ahead, ma'am.
Yeah, I'm from St. Ignatius Nursing College, ma'am.
Yeah, please, ma'am. Go ahead. Yeah, please go ahead.
Yeah, I don't make it mandatory for my staff and students to do, but then my own staff and students are really interested in publishing their research whenever they do it. So almost maybe we are not a bigger group here, only the nursing college. We are running with a BSc and a post-BSc. We don't even have a MSc nursing. But almost per year, we have a 3 to 4 research articles are published, and the children are also, and the staff are really interested in doing their research.
Yeah, that's the best practice actually. If you have a single unitary institute and if you have 4 or 5 articles coming in education, that is, I think you can show it as a best practice. So that's something that we all have to think about. That's very interesting. And actually nursing councils also, their curriculum also is good, and sharing will actually help us implement. So yeah, I think we have to make it a practice. Each one of us, if we can motivate one young faculty in our department or institute to take up a research project or to document whatever new he has done as a teaching learning method, measure its outcome. Just intervention is not important. Measuring the outcome of his intervention, be it in assessment or whatever it is, and then going and presenting in a conference or publishing a paper, we have to close the loop. I think he'll do for somebody else. And the snowballing effect we must see. And I think the onus is on us. And we have to create a bigger mass of researchers interested in this. So, yeah, yeah, thank you all. Like always, when we conduct these workshops, we try to conduct these webinars. We try to choose topics that are like outside the regular medical education domain things. Like we try to see wherein it can cover all health professionals. Thank you for participating and encouraging us. And this feedback, I can put it up here so that if you can tell us how to improve on this or what is it that we can do to attract more participation, we will be more than happy. You'll receive a certificate once you fill the feedback. Thank you, Dr. Das, for sharing your experience. And thank you, Dr. Lokesh, for organizing this. And I thank our academy for providing us an opportunity to conduct these events. Thank you so much. If you can please fill this Google form, your certificates will reach you. On mail, is it? Okay. Are you able to get this on the chat, this Google form? Is there a problem in downloading this link that we have sent? You can leave your mail ID. We will send it to you. If you can, if anybody wants particularly in the mail, please leave your mail ID in the chat box.
Vinuta, we are not able to open it.
You're not able to open it, is it?
No,
One second.
not able to scan also.
One second. In the chat box, ma'am, not on the PPT, in the chat box. Put it on the chat box again.
Let me check.
On the chat box. Any success, ma'am? Any success, ma'am?
I just. Yeah. Got it.
Okay. Thank you. And for sanugna@gmail.com, we'll try to send. We will send. The rest of you, try it on the chat box also. And anything required, please mail us to UCHP@SDUHR. UCHP@SDUHR. One second, I'll just do it. UCHP@SDUHR.ac.in. Right. Thank you once again. Thank you so much. See you until. Yeah. This message will be on your screen. We will exit after 5 minutes. Okay. Thank you all.
ಗಾಯತ್ರಿ ಏನ್ ಮಾಡೋದಿದು? ಆಕ್ಚುಲಿ ನಂದು ಒಂದಿತ್ತು ಅಡ್ಮಿನ್ ಅಟ್ 1 to 3.